Let's talk about hip replacements. I tell patients that I think are good candidates for hip replacement, that I think that the hip replacement is one of the best operations in medicine, that in cataract surgery. And I mean the best operation in medicine because of life-changing occurrence that you can experience from the operative procedure. I had a friend of mine the other night told me that he would put a prostate type of surgery involved with it, but I've always said cataract surgery and hip replacements because it's life-changing. The type of patients that require it, basically the main indications are pain. They have functional difficulties, sometimes with range of motion, but you just can't do what you want. It wakes you up at night. You can't walk the way you want to. You can't function the way you want to. And those are the major indications for it, is really the lack of function and the problems when after the hip replacement you can expect literally a painless hip and that you can do anything you want to literally. Obviously, when I say literally, what I mean is that we're not going to allow you to be running marathons, things of that nature. I don't think that would be in order for you. We look at x-rays and the x-rays give us the answer. Sometimes you get to an MRI which will show it, and but we make the assessment based off of if we can do an arthroscopic procedure sometimes on the younger patients to try to stave off the necessity of the hip replacement, and if that can help, wonderful. If that can't, the hip replacement is what you would do. The hip is a true ball and socket joint where the socket has a lot of depth to it, and on a native hip you can see how the ball can move within the socket appropriately. It's surrounded by ligaments which supports the hip that are not essential necessarily for stability. When we go ahead and we put in a hip replacement, what we will do is we'll put like a cheese grater reamer into the socket, and we will then ream it so that it can accept a metal cup. Then what we do is we will take the ball and we actually will cut it off because it's arthritic, it's not necessary. We'll prepare the thigh bone for a stem, of which this is a stem that can go in, and then it has metal or ceramic head to it. We put a plastic over the top that goes into the metal cup there. That's considered a total hip replacement. So the head can be of different sizes, and the head could be a metal head, it could be a ceramic head that we can use. There's also metal on metal, of which is used. I believe that in this day and age, metal on metal does produce problems, as evidenced by the fact that the one company, DePuy, has an ASR hip out that now has a very large lawsuit against it because of the metal on metal design that they have. There's all other metal on metal problems, which dovetails into the somewhat partial hip replacement, which is the Birmingham hip, where we do not actually put a stem down into the canal, but we resurface the head with a metal on metal articulation, which is articulations of two metal on metal particles that go across each other. You could have an articulation of metal on plastic too. And the metal on metal, I think, it can be potentially problematic. And because of that, I think that, in my opinion, I avoid the metal on metal problem because it doesn't need to be. And I think the track record of a hip replacement that's not metal on metal is exceptional over time. We have, double-digit 20, 30 years of excellent results with these hip replacements. 10-year survival of a hip replacement is over 99%, which is unbelievable. So we're having good operations without metal on metal. My personal opinion is that I just don't use it because I think it brings in another potential problem for a patient, which doesn't need to be.